I didn't tell anyone I went, but it's the most scariest surgery I've ever done. If I die, no one knows I'm even here. And it was this fear over me. I thought, what have you done? Breast augmentation. I had my first one when I was 18, and that was 350 cc's, and that was in Australia. I had my second one in Thailand, it was just 650 cc's. And then my third one, I came out to Miami, and that was 1400 cc's. That was last December, not this December, last.
So what did you start with? What was your
I was 18, so I felt like, at that age, you've got nothing really to really compare. I was thin and kind of lanky in a way. So I was probably like a B, maybe.
Okay.
And back in those days, 350 was massive. These days, it's nothing.
Yeah, honestly, I feel like, back in time, if you say some 350 cc's, everybody's like, oh my God, they're huge.
I was telling him, oh my God, I had double D's and so forth. But evolution changes and everyone's perception of what is normal changes, I guess, in a way. Yeah. So I went from 350 to 650, then to 1400.
Take me through the process. When you were having them done, what way did you do it? Did you do under the breast?
Yes, so I started with under the breast here and always over the muscle. So in Australia, that's the way they were doing them at the time. When I had my second surgery in Thailand, I had the opportunity to go under or over and change the scar placement, but I just felt comfortable with that over the muscle look. So I wanted that round fake look. And then when I came to Miami for the 1400 cc's, I'm not sure if you're aware or not, but in Australia, they don't do over 1,000 cc's.
It's unethical to go over 800 cc's
yes.
anywhere in the world, really.
So in Australia, they don't do it at all. There's not a surgeon who will touch you. So I was silicone for the first two, and then the 1400s was saline. And that was like what you're saying, the 800, where they overfill it to 1400. And then I just got boob greed.
Okay, so to take me through it. In Thailand, the first surgery in Australia, you did 350 cc's, you went under the breast. When you went to Thailand, you still went under the boob and over the muscle?
Yes.
And that was the 800 cc's that were filled?
That was 650 in 650.
Thailand. Okay.
And that was as big as they were doing me there at that time as well.
Okay. Was it because of the skin just wasn't stretching enough? Or
I think it was more ethical. They were a bit more conservative during that time. And at that stage, many girls were probably still on the relative conservative size. Of sizing, so to speak.
Okay. Well, what was the experience like between Australia and Thailand?
So with Australia, you've got your surgeons obviously around Australia, and it's you go in, you go straight back out that day. The appeal for me for Thailand was we had these packages, which you can go from Australia, go to Thailand. It includes your hospital transfers, your hotel stay for 7 nights, a guide. So it's like an experience with someone.
It's like a tourism surgery.
Like a medical tourism surgery.
Yeah.
And so for the price you could do that, you got a holiday as well. And so for me, that kind of felt like a different way to do it as opposed to my first time. I went in and I left after 2 hours' time and I was in a lot of pain. So I thought the best thing for me was to go, have someone around me for 24/7 for 7 days, have a holiday as well.
Yeah.
And the price-wise was comparable, to be honest.
Oh, wow. Okay. After that, 650 cc's.
Yeah.
Did you think it wasn't big enough?
Yes. To be completely honest, I have spoken on this topic before. Then came Instagram. Right. And it was Instagram came, and then I was seeing so many American women with these big boobs, and I hadn't seen them before. And then, with your feed and your algorithm, you start looking.
It gets more and more.
My feed was just boobs. And I was like, I want that. And obviously in Australia, they don't do big enough. So I had a few girlfriends come to Miami, have it done. I reached out to a surgeon and so forth over there. I went to South Florida in Fort Lauderdale. I didn't tell anyone, which is the silliest.
You went by yourself?
Yes, and I didn't tell anyone I went. It's the most scariest surgery I've ever done looking back.
That's crazy.
I think because I knew I was doing something so drastic and I knew I'd get negativity or so forth, I just hopped on a plane and left. When I went into the operating theatre, it just dawned on me thinking, if I die, no one knows I'm even here. And it was this fear over me. I thought, what have you done? So since then, I'll always make sure
at least one person.
Yeah.
Okay, so when you did it in Miami, they put 800 cc's and they filled them?
Yes, yeah, they did in the saline. So the first two were silicone, and then that was saline.
And when you say fill, explain to people what filling means.
Yes, so they put the implant as a shell, so to speak, inside of you, and then they fill it with a saline with a syringe up until the cc's that they can get in, so to speak.
And they close it off, and it's basically like a normal breast implant.
Yes.
Do they leave like an opening or something for it to be filled more?
There is a valve, and you can have them so they can expand, but some people prefer just to go again and start again with a new shell, so to speak.
Yeah, that makes sense.
Yeah.
So then 1400 cc's was the biggest one.
Yes.
What happened then? Because this is not 1400
This is not
cc's.
1400. This is not. So I had a few girlfriends in Australia who had gone 1500, 1800, and I kind of was like, I want that too. So I'd researched for the last 2 years, a year prior to my last surgery, about Dr. Rivas. He's a guy in Miami who's amazing. He's known as a boob whisperer.
The fourth surgery was also in Fort Lauderdale.
I did a lot of research on him. He's quite expensive, so to speak. Everyone seems to go to him for the extra large ones. So I reached out to him, and he actually just had an opening. So I went last Wednesday and got him done.
You went last Wednesday to have your boobs done.
Yes. So they're a
These
week
are
old.
fresh. These are so I was going to say, you have a few bruises in you.
Oh, that's nothing. Around the sides and stuff, really bad. But yes.
What happened? Did you...
Just bruising. I always bruise with all my surgeries. So it will go away, but...
Wow.
Yeah.
So what size is it now?
2,100.
2,100 cc's.
Yes.
I have a question. Do you think they're big enough?
I do now. If you had asked me last Wednesday, I was devastated because I did ask for 2,400. And when I got out of surgery, he said he could not get any more in there. Since I've got the 2,100s, they are heavy. Compared to the 1,400.
They look heavy.
I don't think I could go any bigger.
Have you had done like any internal bras or anything to hold?
Yes, so this one I had the internal bra. That's probably where you can see the bruising all along here.
Oh, yeah, so it's all on the side. Yeah, you can
so
see
that's
it.
from that. So this is the first surgery I've had the internal bra. He wouldn't do it unless I had that done. So hopefully that will be a good thing.
From what I've heard, it helps girls to hold it and the weight with your back and everything. It's better for your skin just because, it doesn't drag it down because it's so heavy.
And I'm still over the muscle. So if I had 2,100 over the muscle.
Over the muscle.
They would just drop otherwise. So, yeah.
Girl, how do you do that?
I don't know.
That's crazy. Don't they say that under the muscle helps you with like protect the implant?
Yes. So I just like the over the muscle look, and I've had it done so many times. If I was to go under, I wouldn't have been able to go this big because I would have to stretch my muscle from the start.
Yeah, that makes sense.
And I'm at 4 now, and I think 4 is my max.
Okay, so tell me about your last experience. So from the moment when you decided you're going to go to this doctor and he told you there's an opening.
Yes.
What happened?
I was very excited. It was pretty rush, obviously, last minute. Normally it's like a 6-month wait. So it was a scramble to get the bras, to get everything you needed to sleep with. From my previous surgeries, you learn what you need along the way. Mm-hmm. Even such things like satin pajamas and stuff, your little comforts, to have it. So I got everything ready, went there, and I did freak out in the morning.
How so?
Before I went in, I was crying. And I've never really cried before, but I was just crying thinking, because the last time, no one knew. This time people did. But I was also having that fear of, oh my God, am I doing the right thing? Is this going to be the right thing? So I was having second thoughts. But when I woke up, I felt fine.
Yeah. I'm assuming he went under the boob as well, and then...
No, so this is a different one. So he doesn't do it under the boob. So I've got it in the nipple, and it's only like a half circle, which I was surprised. I expected it to be the
whole thing.
So hence why I guess when they're putting the shell in...
They say it's like a half moon surgery or something where they cut half of the areola and then they put the implant through there and then they stitch it back up, and then... Honestly, when it heals, you can't really tell unless you had really stretched skin.
Yeah, I was actually surprised because in the past, I've never wanted to change from under the boob, thinking about the scars would be worse. But to be honest, the one under the boob was probably about this long, whereas this is going to be tiny. So I was actually quite shocked. But then again, my knowledge wasn't the same, that they put the shell in and then filled it up, so to speak. So,
yeah. It's actually funny that you mentioned that. I know a lot of different ways to have breast augmentations, but I've only recently learned on this podcast that you can have your boobs done through a belly button.
I did hear about that.
It's insane. Honestly, when the girl showed me her scar, it was inside of her belly button. It was tiny, so if you have like a jewelry or anything, you won't even be able to tell.
Wow.
And she had 600 cc. One it was 600, the other was 640. They looked fantastic, and the doctor said if she ever decides to take them out, you can take them out completely the same way.
Really?
Honestly, I was shocked.
I'm shocked as well. So what's the advantages of that?
Well, you don't have any scars.
Any scar. Okay.
Yeah.
It feels weird. Like imagine it going through all your organs together.
Yeah, because basically that's what they do. They put 2 pipes in, like to each boob, whether it's under the muscle or the muscle. They push the implant through, they fill it up and stitch you up.
Wow.
So
maybe that'll be my 5th one. No, joking.
You say that now. A year later, she goes, can I come back on the podcast? I have something to tell you. So besides breast augmentations, obviously just boobs obsessed? Like what happened?
Yeah, I kind of like the Pamela Anderson look. So I grew up around that era. I like the big boobs, skinny type look. So boobs have always been a massive thing for me. Yeah, I like the progression of it all. I think it's something that you feel confident in yourself with, and I can't imagine not having them.
So how about your friends and family though?
Well, my friends and family.
That's where it starts.
Well, remember, these were only a week old, and my friends and family in Australia haven't seen them yet. So
this would be the first one. Hi, family.
No, so no one's actually seen them. So
wow. Okay.
Hi. And I didn't tell anyone except for my close, obviously, family. They think I'm crazy, but they're happy as long as I'm safe.
Did you tell them that you're going to have it done this time?
I did, but I didn't say how big.
Okay, but they were they kind of probably knew from the last time that it's going to be something.
Yeah. Look, it's your own journey anyway. I think if people around you can validate you're doing the right thing, that's great. If they don't, still, as long as you're being in a healthy, safe range of surgery, I think you're okay. Obviously not going to the extremes.
What is one thing that you think people don't think about when they go into the surgery for the extra large implants?
The recovery. I thought, so my last surgery, I had them done, and 7 days later, I was flying back to Australia, and I was able to do normal activity. There is no way in hell at 7 days right now, I could either fly or do much normal activity at all. So I think the bigger you go, the longer the recovery is going to be. And obviously the complications can come along. You've got to make sure you're not stretch it out. Yeah, I just think it's the biggest thing is recovery, like longer than normally.
For me personally, so at one point, I haven't really spoken on this podcast about my personal experience. I have said bits here and there, but at one point I had 1,050 cc's. What happened is my skin in between my boobs started coming off my chest, like sternum. And that was quite scary because the weight of the breast, right? Do you get any of that? Like, how does that work?
I'm nervous every surgery that even like now, I'm making sure, obviously I've got this dress on now. Obviously I have got my post-op bra as soon as I get out of here. But I am very conscious of all those type of things that could happen. They're never far from your mind if you've done it more than once, I think. And it's expensive. And it's a lot of time, recovery, mental, and you can't really afford to keep doing it again if you're not doing it right. I think researching your surgeon is the biggest thing, but also knowing that your body is your body. I think so people forget different. That they expect to look at a picture and look like that. And, they can't, not replicating. Your body will recover how it's going to recover.
Yeah, absolutely.
I think there's always needs to be a plan B just in case.
When you say plan B, what do you mean by that?
So a plan B I would have, so make sure you've got some funds aside. If that's your last dollar and you need to get something emergency done, have some extra funds aside, have some extra support aside, some time off work. I just think having that extra buffer so there's not that stress about that just in case.
How do you feel like do you think people's opinions changed about you since you had bigger implants?
Yes, good and bad. It depends on which demographic you're asking. Look, you're obviously going to get people who are very anti-surgery or who are maybe an older generation who don't like this look. And then you get people who are a bit younger who might be a bit naive or misinformed. They think it's their right to say something negative out loud and so forth. I had it here in Vegas last time. I walked through a group of people and people yelling out names at me.
But that was before you even had the size, right?
For this one.
You only had 1,400 cc's, right?
And they were still yelling out at me. And I was like, oh, you're so misinformed. Like, if I was obese and walking down, you wouldn't say a thing. But for some reason, people think that they can say something negative because it's surgery. And it's the same thing. You're bullying. It's relatively the same thing.
Honestly, I think that's one of the things I didn't want to bring on the podcast before, and I feel like we should. The bullying part.
Yeah.
Just because you have decided to have a choice of specific surgery or whatever, for whatever reason that is. It could be medical, it could be for beautification, looks maxim, whatever that is. But it's still bullying. If you call people names when they walk past you and you don't agree with them, just let them go past you.
Yeah, the old saying, if you haven't got anything nice to say, don't say anything at all.
Exactly.
But it seems to be this culture where people think because it's elective and it's abnormal to them or their circle, that they feel that they've got a right to say something. I usually don't say anything. Sometimes I do, and I make sure I do it with decorum and grace. I always try and I call it redirecting or re-educating people. What they don't know is what they don't know. So sometimes people will look at you and think a certain thing, but when you go and speak to them, they're like, "Oh, you're actually a nice person," and they're like, that removes that stigma. So yeah, I think it's one of those things where in the 21st century we are all doing it. All of us are. Even if you're getting your nails done, you're still beautifying yourself.
Yeah.
Just in different levels. And it's just, I think it's a thing where accept what people are doing. If it's not affecting you directly, then let it be.
I believe that too. If it makes no difference to your personal life and it doesn't affect you, then just let it be. Let people do whatever they want, because at the end of the day, everybody has the different lives and different opinions and different tastes. So
absolutely, unless it's unsafe and you see someone doing crazy stuff, yeah, sure. If you feel it as a friend, you need to step in. Absolutely, but other than that, I think you would never go up to an obese person and heckle them.
Yeah.
Use that as your guide. So why would you do it with someone with a boob job? It's the same thing.
Exactly. Have you had any other surgeries besides breasts?
Yes, I had my nose done when I was like 19, which didn't turn out perfectly. I'm actually off to Turkey next month.
Wow.
Yes, I'm getting a facelift and a nose job next month in Turkey.
Okay, I have a question. First of all, where are you going in Turkey?
In Istanbul.
Okay.
Yeah.
Have you? I'm assuming you haven't been to Turkey before.
No, I haven't. No.
Tourism.
No.
How are you feeling?
I'm feeling pretty good. I've had a few girlfriends who've gone and had the same surgeries done. So I'm going to their same doctors. And yeah, I'm kind of excited. I know it's going to be painful.
What doctors?
I can't say them.
Oh, okay. Okay, yeah, no worries. It's actually pretty exciting. And you having your nose done?
And a facelift.
And a facelift.
Yes.
That's scary.
I know. I'm a little bit, probably more scared about that than anything, but I have had friends have it done. Yeah, I think it's Turkey, they do great faces. I think they've got good rapport. Yeah, that'll be my next one.
Okay, awesome. And you're going under, I'm assuming, obviously.
Yes.
So let's talk about being under.
Yes.
How does that feel for you?
I always fall asleep before I even get in the room mostly. I kind of enjoy it like a nice sleep. I don't recover well afterwards. When I wake up, I'm always vomiting, regardless if they give me the stuff to stop you. I always do anyway. Works out now not to panic. So, yeah.
So basically when you wake up, instead of panicking because you're throwing up, you kind of just let it go.
I just go with it now, whereas I used to get really like, something's wrong, and it's not. Yeah.
That makes sense. Okay. How long was your last recovery?
So my last recovery was the boobs last time. Look, like I said, I flew home to Australia and I was pretty okay after 7 days, but I would have been 4 weeks where it was kind of tender and sore, so to speak. I am going to envision that this one will be longer.
Have you had any complications ever?
I have had the capsule
contraction?
Yeah, I had that on my second surgery.
And do you know how it happened or?
No, I don't really know. I've heard different reasons why it can happen, but yeah, I'm not quite sure.
And explain, how did you find out?
I could feel it. It was in my left breast and it was getting hard, like really hard. To the point they were like rocks.
Oh, wow. Okay.
Yeah.
And how long did you hold off to go to the doctors?
To be honest, I left it for a while because even though they were hard, it was still the same look. So for me, I was just thinking that was my body.
Yeah.
And they didn't look odd. And then it was only when the one started getting smaller, because it was so hard, that I went.
Was it drying? Is that what was happening?
It was just going like this, and it was squeezing and it was hurting. But it still was circle perfect. So it was just like.
That's so interesting.
So, and I had some acupuncture, I had some Botox and bits and pieces around to try and fix it as much as I could. And then that kind of gave a bit of relief until I had the next surgery.
Which one do you prefer, silicone or saline?
I'm not quite sure, to be honest. I kind of like the saline at the moment. I think they look a bit more natural, so to speak. Say natural.
As natural as you can be.
Than silicone, I think. But yeah.
Awesome. Well, I would like to go into the next segment, if that's okay with you. And for the next segment, we're going to do Would You Do It from 1 to 10. But 1 is you would never do it. And then 10, you would definitely do it.
I'm actually getting a butt implant in September.
This girl. I'm not having babies down again, but I'm doing 150. I'm doing 150 other surgeries. Why implant?
Because I haven't got enough fat for the BBL. So I'm just going to get like a little 400cc butt implant. I probably should have told you this beforehand.
I'm like, what? Do you just don't want to put weight on or like?
Yeah, I don't really want to try to, but I kind of like the look of the butt implant if it's just done small.
Okay. Lip filler.
10.
Buccal fat removal.
1.
Rhinoplasty.
10.
Chin implant.
Haven't thought about that one. Maybe a 5.
I'm going to give you ideas now. Facelift.
10.
Breast implants.
1.
Oh,
Yeah.
jawline filler.
10.
And intimate procedures.
8.
Okay. You said buccal fat removal 0. 1, sorry. It's basically a 0.
Yeah.
What happened there?
No, I wouldn't have it done. I just feel like I've got a thinner face, and with the facelift, I don't think I'd need to have it
makes
done.
sense. Intimate procedures 8.
I have looked into it. It intrigues me. It scares the hell out of me as well. I can't imagine how painful it would be, but
I have a friend, she had her labia reduced.
Yeah.
And it was funny because she would come to our house and she would always wear like a nappy, like a Pampers or whatever, right? And I'm like, why are you wearing this for? And she goes, well, I just had a labiaplasty. So, and she was walking kind of funny. And I'm like, does it hurt? She's like, honestly, it's not too bad.
Really?
Yeah. And I was really surprised. And she had like big breast surgery as well. So I was like, okay, interesting. And I was like, can you still feel everything? Because, you know, that's probably one of the most important parts. And she was like, yeah, everything's feeling great. And it looks fresh. Like if I'm just fresh out of the oven, you know?
And she likes it now? Or?
Oh, she loves it. Yeah.
Yeah, amazing. So
Yeah.
I've looked into it. I've had children, so a little bit older, I guess. So for me, I've looked into it. I've seen the pictures. It's just the pain that scares me about it. So
Yeah, honestly, that area is so sensitive. I can't even think that if somebody would have to cut it or anything. And what are you kids thinking about the breastification?
Look, they're quite funny. They're used to it by now, I guess. Obviously, when I'm around them, for the beach, I don't wear the same bikinis as I would by myself.
Yeah.
Not that I changed completely, but they're teenagers, they're in high school, so
It's only fair if
like I choose this life, they haven't. So, I'm got to make sure that they don't bear, my ridicule, so to speak.
That's pretty
sometimes.
nice.
Yeah.
Yeah, that's good. Okay, awesome. So, did you have any drains in your surgeries?
No, I didn't. I was actually surprised. I thought this one I would have had, but no. So
That
I'm
is
not
actually
sure if
really
that's-
surprising, because you would think there would be extra fluid considering they put an internal bra and everything.
Exactly. I'm so obviously swollen, but I was very swollen afterwards, and I was confused, like, why didn't I have the drains? But
Did you ever deal with displacement of implants?
no, I've been pretty lucky so far. I think being over the muscle and being, I guess, slim in a way, they've kind of stuck to where they are. And to be honest, maybe the capsulation I've had in the past has kind of stuck them where they're meant to be.
That makes sense.
Yeah.
And have you ever had any rippling or symastia?
I've had rippling the 1400s had rippling. So on this breast here, it was rippled all the way along here. I was pretty thin last year, so like probably about 6 or 7 kilos less than I am now. And I got the rippling really bad.
Is that because it was saline?
I think it was because my skin is so thin and I was like the rippling was straight on there, but maybe because of the saline, but it was pretty evident.
Yeah, because they say that with saline, the rippling is more visual than with
Yes.
silicone.
And if I went forward like this, you could see the whole rippling all the way along.
That's another thing that I'm a little bit sad about, because sometimes you can have the best looking boobs, but that rippling just makes such a big difference.
Absolutely.
And it's like, as soon as you turn or like bend or whatever, you can just see that. And it's just, why can't you just stay nice
I know,
and
right?
rounded, right? Okay, so for the next segment, I would like to do this or that. You just choose one or the other. Breast augmentation or BBL?
BBL.
Breast lift or implants?
Implants.
Saline or silicone?
Saline.
Chin lipo or jawline filler?
Jawline filler.
Filler or fat transfer?
Filler.
Surgical facelift or filler?
Surgical facelift.
Big lips or balanced?
Big lips.
Super white veneers or natural shade?
Super white.
0 wrinkles or natural movement?
0, 0, 0.
BBL or athletic shape?
Like the BBL, but in an athletic shape.
Okay.
Can we go for 2?
two in one. Snatched nose or natural nose?
Snatched.
Awake procedure or general anesthesia?
Oh, general anesthesia.
She's not staying awake. For
No
that
way.
One. And you mentioned to me that you having your butt implants done.
No, so I'm getting them done in September.
Okay, and where are you having them done?
In LA.
Is it safe to go 3 times under in the same year?
I'm not sure.
You should probably research
I
that.
might research that one out, yeah. I was trying to get them all done at the same time, and I got told that was a no. Because I want to get everything done and recover all at once, but apparently you need to have space in between.
Well, technically you could do facelift and butt implants at the same time.
Yeah.
But then what else were you going to do? So you have your butt implants?
Yeah, and just the face, the nose.
And you already had your breast done?
Yeah.
See?
I think I need these to heal before I did the butt, though, because I wouldn't be able
for sure.
wouldn't be able to lay on my stomach. or
Yeah,
anything.
for sure, because that would be extremely painful, because I had my lipo and BBL done at the same time. I would not wish it to my worst enemy.
Yes.
I genuinely, when I woke up, I thought I might pass away. Yeah, and it was extremely painful, but It's all good now.
Yes,
I'm here.
now, look now.
I'm here today, so that's great. But implants, 400 cc's. And what doctor are you going to?
Dr. Stanton.
And that's in Beverly Hills?
Yes, so he's quite well known for his little butts he does. I'm not a fan of the hip.
Yeah,
that
the
one.
sides.
It's like the little one on the butt.
What made you have a butt implant?
I think just to even out now, I've gone so big breast-wise, I think I need to have something on the
At the bottom?
Yeah,
Yeah.
you know, although I'm top heavy. So nothing crazy. And 400 cc sounds a lot, but it's not. Just a little bit just to push out the skin so you've got some kind of curvature.
Yeah, that makes sense.
Yeah.
And do you do anything specific to kind of keep your looks and everything like that? Obviously, looks maxing, there's a lot goes in. I'm sure you have to dye your hair and everything else. But do you do anything special that maybe a normal person wouldn't do?
Not really, I don't think. I kind of just maintain as much as I can. I think that's it. And I think obviously mental stuff is good, like yoga and meditation and things just to keep you grounded. I think that helps a lot. I do a float once a week.
What's a float?
A floating tank.
Is it when you, like a dark chamber where you lay down?
And you go in there and you float in the water, like you keep your float.
Huh.
And that's meant to be good for your body, all the minerals and salts. So every Monday I float.
Is that in Vegas?
Not here, no. So
It's in Australia?
yeah.
I was going to say, like, I don't even know if we have anything like that. But if you're watching and you know a place, please make sure that you comment below so we know where to go to have that done.
It's really nice. It's like all the salts and minerals get into your skin. Kind of like just refreshes you, starts you for the week. So that's kind of my Monday thing I do. And then the rest is just maintenance, I guess, as we go along.
Okay, awesome. Well, where can people find you?
So I'm on Instagram, SeptemberSummers_, on X or Twitter. What do you call it these days? X?
Either or.
Either or. September's SVIP, and obviously some other channels as well through that.
I'm sure you guys will be able to find her channels in her Instagram and Twitter. But, well, thank you so much for sharing your story and coming on and...
Well, thank you for having me my last week here in Vegas before I go back to Australia. So thank you very much.
Of course, thank you. And well, guys, if you like this video, make sure that you click on the next one. You might like it too. And make sure that you like this video, send it to your friends, comment, and we will see you in the next one. Bye.